Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about corns and calluses, their symptoms, the underlying cause, and the benefits of different treatment options. The symptoms of corns and calluses are abnormally thick, hardened skin, usually appearing on the toe joints and soles of the feet, but they can actually show up anywhere. Corns or calluses are indicative of a bigger problem: poorly functioning arches of the feet. What causes corns and calluses? Wearing unhealthy footwear over extended periods of time causes the feet and their function to maladapt. Corns and calluses occur when movement of the foot inside the shoe creates localized points of inappropriate pressure, rubbing, and friction. For proper function, our feet require the right stimulus and the right movement. Right stimulus consists of the subtle, varied stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimal muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches before our feet contact the ground to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent excessive pronation. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned-out brain response is natural and happens all the time. The same thing happens when we walk into a room and first smell the coffee, and then after a few minutes, we don't notice the smell of the coffee at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Impaired right stimulus and right movement can lead to foot instability and related excess movement that can result in the formation of corns and calluses. Conventional treatment methods for corns and calluses include the following: supportive products such as orthotics, local cushioning, taping, grinding and shaving of the hardened tissue. While these methods may temporarily alleviate symptoms, they don't address the cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. These support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes corns and calluses and prevent them from recurring, I recommend the following. Walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPod stim soles. For best results in conventional footwear, use BioPod stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Remember to consult with your healthcare practitioner and to ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.